We are honored to have Dr. Yasser here today with us. I didn't know much about the organization, the work you do. I think we kind of live in a world of silos where, whatever we're doing here, we're kind of only exposed to what's happening here, and then we get a chance to hear from people outside, but not much exposure. So I'm really happy that you came. Jazakallah khair for accepting invitation. But I wanted to introduce you first of all, and then just to start our conversation here. Dr. Yasser Abu-Jamei, is that the reference? Okay, mashallah. He's a psychiatrist. He's the director general of the Gaza Community Mental Health Program in Gaza Strip. He has degrees from universities in UK, Germany, Lithuania, and Gaza, and received honors for his work in developing the mental health sector in the Gaza Strip. The Gaza Community Mental Health Program, or the GCMHP, is a leading Palestinian non-governmental organization providing mental health services to the Gaza Strip. Founded in 1990 by Dr. Iyad al-Sarraj, and Dr. Yasser became its head in 2014 after Dr. al-Sarraj passed away. And he has been able to steer the organization through, I can imagine, very devastating times. So, Jazakallah khair for being here. I wanted to ask you first, just to start off our conversation, to tell us how you got onto this path, and obviously the need for mental health services is there, but your own kind of journey in what we have today in Gaza and the work that you're doing, mashallah.
Thank you very much, Dr. Fahad, and it's really a pleasure to be at Khalil Center. Things look wonderful, and I kept hearing about the work you are doing. Yes, we live in silos, but I think the good words all the time find the good ears, if we could say. Yes, well, I initially went back to Gaza, Palestine in the year 2000, in the summer of the year 2000. And at the beginning, I thought of becoming a pediatrician. So I started doing the rotation, like first year residency at the Nasser Hospital Pediatric Department, Pediatric Emergency Department. And I stayed there for about 13, 15 months. It was interesting kind of work, but we had to see, we had seen different manifestations of unexplainable, let me say, children problems, mainly screaming during the night. They would come to the hospital. No one would really know what's wrong with them. They could be 2 or 3 years of old age. And even the senior pediatricians were thinking maybe they have an ear problem, because sometimes otitis or ear inflammation might cause some, extremely stressful pain. Say they would give the child something until the child would go in the morning to the OT specialist. And it was also a few months after I arrived in Gaza, the second intifada began. And things were getting more and more intense in Gaza Strip. And there was a moment that I heard about the diploma program that Iyad al-Sarraj founded in 1997 at GCMHP. And to me, it looked really appealing to look into the mental health, So I thought, why not? I felt that the need is intense, the need is there, why not? So I joined the diploma program, and that's how I started to be with GCMHP family. And after finishing the diploma program in 2003, I was lucky to get a chance to start working at the organization in 2004. Since then, I started working there.
Mashallah. How many organizations are in the Gaza Strip right now that are actually doing the type of work that you're doing there?
Well, when it comes to mental health interventions, if we speak about specialized care, which is like psychotherapy and pharmacotherapy, where you need a multidisciplinary team led by psychiatrists in the presence of psychologists, social workers, and nurses. We are the only non-governmental organization that provide that work. And this comes in addition to the clinics that belong to or community centers that belong to the Ministry of Health.
Okay.
But as a non-governmental, non-profit organization, we are the only ones. There are many other organizations that work at lower levels of intervention, like counseling, for example, raising awareness, recreational activities, but
Mm.
at the level of therapy, it's only GCMHP.
I see. And the GCMHP, what type of services are being offered right now for the people in Gaza?
Well, there's a variety of services. Well, when we began in 1990,
Mm.
Dr. Riyad was then, the late Dr. Riyad was then working at the psychiatric hospital, which was the only facility that offers mental health interventions in Gaza Strip. That's in the 80s, you know. But in 88, it was already the second year of Intifada, and things were tense. And uh, he was thinking, how could we help children and families, and how we could help the community at large overcome the difficulties and the challenges that are faced by the occupations, you know. And he traveled in Europe, and he was by a chance attending a conference in Sweden,
Mm.
where he spoke uh, about mental health and human rights in Palestine. He met two Swedish psychiatrists. One was a pediatric neurologist, and the other was a child psychiatrist. And together they thought that it's the best way to help people is to offer comprehensive mental health intervention.
Right.
So comprehensive means that you don't really focus on the biological aspect,
Mm.
but you also look into some other things. That's why we call it a biopsychosocial model.
Mm.
Of course, now they say biopsychosocial and rehabilitative
Mm-hmm.
model. You know, things change, no words change.
Mm-hmm.
But in Gaza, it was the need that created the beginning of GCMHP. So he started as one small community center in Gaza City with a group of less than 9 people. And the idea was to not work only at the level of therapy, but again, comprehensive means to work at the level also of primary intervention, which is very important. When we began, for example, people were hesitant to come to the services.
Mm.
All of the cases that were referred to GCMHP were referred by a physician, you know, not by self-referral, you know. I think that was because maybe people didn't know much,
Right.
but also because of the stigma. With time, we have developed. So the one community center is now 3. We have a second one in Khan Yunis, in the south, which was established in 1992, and the third one in the middle area, which was established in 1996. Through the 3 community centers, we try to support as many people in the Gaza Strip. Now, it was obvious that the living conditions continued to be challenging, you know. And the idea was to try to bring more, let me say, manpower, you know.
Mm.
And you can recruit people, but that cannot go endlessly, you know. Then we started to have capacity building programs. So we are training people, for example, nurses and psychologists working in hospitals, primary health care, working, for example, for the UNRWA, working for different places, in order to at least help them identify cases in need for community mental health services and know where to refer them. And then in 1997, we started a high diploma in community mental health. So we have graduates of medicine, psychology, sociology, nursing, and sometimes occupational therapy or physiotherapy. They work together. They join a 2-year postgraduate diploma. The first year is purely a theoretical one. And then once they finish it, they are divided into our 3 community centers where they spend the second year. And then they get the skills that they need in order to work. And once they are, once they graduate, they become, let me say, they have enough skills and theory in order to help the people. Over the years, we have, I think, more than 350 graduates already since 1997. We accept about 15 a year. And those are the backbone, actually, of the mental health services in Gaza Strip, whether in local organizations, international organizations, non-governmental sector, or even the governmental and NORWA sectors. So the first one is if you could divide it into 2 or 3 main categories. The first one is therapy. We work at the individual level. The second one is working also at the individual level, but at building capacities of others. And then there is a third component which is very important, that we work with the community at large.
Mm.
For example, you cannot really just sit and wait until people show up.
Absolutely. Yeah.
So you need to educate the community
Mm.
about things, about mental health. Also, people do not know. They parents do not know how the traumatic event, for example, would how it will affect their children.
Mm-hmm.
Sometimes it's obvious, it's clear, but
Mm-hmm.
in other times, many other times, it's not that obvious and clear. So you need to educate the
Mm-hmm.
population. You need to tell people that mental health, it's not a stigma.
Mm-hmm.
It's an illness. If you have a disorder, that you need a treatment.
Right.
And it's like any other disorder. Some of the times the healing is inshallah 100%, and sometimes it's not
Mm-hmm.
100%. You need to continue to be on medication. It's like any other part of medicine, but it's a little bit people are sensitive about
Mm-hmm.
it, because it's not only a biological factor,
Mm-hmm.
but it touches many other things. And then we do every now and then some research work. The research aims at one, for example, documenting what happens in the Palestinian community. Then some of the research that we do is looking into the effectiveness of the interventions that we do. So whether we are in the right direction or not in the right direction. And then we try to do some publications as much as we can. Those publications aim at providing, at hand information to people. Some of them, they could be local people, Palestinians, like brochures about different topics.
Mm-hmm.
Some could be in the international community when we write, for example, when we publish a journal article, when we write something on a magazine or so. So it's quite plenty of diverse activities. But if you work in mental health, you need this. You need to
Yes.
be active.
Yeah.
And one final thing, that's I think one of the powerful things that are needed is all the time good networking and good advocacy. You need to connect people, you need to inform people about the services, and you need to work together. So if you provide the service at the tertiary level, for example, then you need to get connected with other service providers who can refer cases to you.
Right.
So this is in short or in brief.
Yeah, no, you reminded me of the Khalil Center kind of journey as well. Obviously you're in the trenches and you have to, like, it's a lot more like frontline work. But I think it's very similar in a way that we started with intervention services, and then training is a component, because you have to train people, and to not just to offload the burden, but also to increase awareness. And then the workshop thing that you mentioned, like going to the communities and actually informing them of it, because unfortunately, even here, like in the US, where people are very educated and they're much more aware than in some of the other countries in Europe or even in Asian countries, people generally don't care about mental health unless it's like really affecting them individually or their children. And even then, sometimes it's too late. They're told that this might be because of trauma, because of depression, and they kind of ignore it. And then, eventually they find a cave in because now it's getting out of hand. There's substance use and other issues that are coming in. So speaking on that, what kind of mental health comorbidities, or even like physical health issues that you have seen as a psychiatrist? I'm sure you can give us perspective on both sides. People in Gaza, what are some of the most common ones that you see?
And um, first, you reminded me asking about the physical issues when you speak to a psychiatrist of a research that was made by GCMHP, I think in 2003 or 4.
Mhm.
And then we found out that about 1/3 of the people who go to primary healthcare, they have mental health issues, mainly somatic complaints, but they end up just having a painkiller or some sort of energetic tablets, and that's it. They get a sort of tablets, and they end up doing that, while the clear reason for that complaint is not identified. But generally speaking, we speak about two main categories of illnesses that could be, I wouldn't say unique, but we see them mostly in Gaza Strip. Uh, it's now, for example, in the year 2021 and the year 2022, most of the patients come with the diagnosis of depression, about 35 to 40%. So 40% of women come with depression, 35% of men come with depression. So this is the highest percentage. And then that is followed by anxiety disorders and large PTSD, including, of course, included. That's about 25 to 30%. But it's more in men than in women. And again, but it's not that much. It's about 5% more or less. So these are the main two kinds of complaints that come to GCMHP when it comes to adults. And the third is psychosis, and then comes all the other disorders. Psychosis is about 20 to 25%. When it comes to children, about 70 to 80% of the children come to our community centers for trauma-related complaints. Last year, for example, we have seen, I think, 4,500 cases, around 4,400 to 4,500, including 1,300 children, and the remaining were adults. So about 1/3 of the people who come to our community center, sometimes a little bit less than that, are children. We feel that when it comes to children, it's people are more resistant of reaching the services, and at the same time, perhaps the stigma is higher on that. That's why one of the big services that we do is I spoke about community intervention, but I didn't give the details. So we work with kindergartens, we work with schools, we work with sport clubs, and that includes like multi-layer intervention. So at one level, we start by training the staff who are, let me say, like school counselors at schools, like sport clubs. We speak about sport coaches, and then we speak about kindergarten teachers. And the idea is to just give them at hand, information. One of the things that are very important for any clinician or any school counselor or any even teacher to know is the, for example, developmental stages, child developmental stages, because sometimes, especially at the age of kindergarten, kindergarten age, I mean, children grow up in a very fast manner in their first year of life, and then the second year of life, and then the first 5 years of life. And sometimes we tell mothers, we tell teachers, for example, if you have a child who was born in December, for example, and another child who was born in February, that's about 10 months gap between them, but they end up being in the same grade. So actually the intellectual and the cognitive differences are huge between those two people, especially when we speak about two children, especially when we speak about a 3-year-old child, 4-year-old child. So we tell the people, the educators, that beware of that. You cannot think or feel that the younger child is performing poor because his cognitive capacities or abilities are low. Maybe it's his just developmental stage. School counselors, we try to help school counselor address the main issues that come to schools for school children, because schooling is a big tough issue in Gaza Strip, with very crowded schools, very crowded classrooms, and with only one school counselor per school. That's almost one school counselor per 800 to 900 children. So what can he or she do? But at least we give them some training, and then we work together with them. We send our psychologists to spend 1 day per week, for example, or 2 days per week with the school counselor. They both provide joint counseling to the children. Children who need more attention, who need therapy, will be referred to our community centers, while others will be treated at the schools, which is less stigmatizing. You can call parents, they can come to the school, they understand what's wrong, and such ways you can just overcome and work around the difficulty that is associated with stigma or with child issues. We have we're working now for about 33 years. In April it will be 33 years. We have accumulated a lot of experience, and we try to uh, be creative in addressing the needs of the population, especially when such a high traumatic environment, and at the same time it's a Middle Eastern society with a lot of stigma towards mental health, some poor understanding sometimes, mixture of relationship between the psyche, the religion, and the physical aspect of it.
Mm.
And you need to be careful not to be misunderstood. You need to address the people in the right manner.
Mm. When you say that, you're talking about like people might like miss or assume something that might be of a religious cause, but it's actually like a psychological issue.
Yeah.
Yeah, we see that here too in the U.S. It's a very common issue with Muslims. But going back to the issues with children, I think what I heard was that you're doing a lot of work trying to even educate the community because they're not aware of it. So even like something that's like a developmental difference, which people are not aware of, but on top of that, there's the layer of then trauma that comes in with children because of the environment that they live in, and I'm sure that complicates it even more. You mentioned earlier like a little 2-year-old's crying, and probably not because of an ear infection. So can you tell us a little bit more about like what kind of symptoms do these children's come to you with when they're traumatized, and how do you catch it early on, recognizing that this is trauma versus something that might be like ear infection or something else?
There are some easy to identify symptoms, like for example, sleep problems, sleep disturbances. It could be night mares, or it could be night terrors or night horrors. The difference is that, one child will wake up screaming in the middle of the night while he or she is still sleeping, and when the mother or father end up waking that child up, the child, if he's asked what's wrong, he will not understand, will not say anything. It was just unconscious, everything that So that's why we call it night terror or horror rather than a nightmare. While the nightmare, it's you awaken someone up and he still remembers what happened. Younger children tend up to have more of a night terrors, while older ones, they tend up to have very similar to adults, which is the nightmare. So sleeping disturbances is one thing that we could think of. The other thing is you can have someone with clear PTSD symptoms, and this is more for older children, like they have all the set of symptoms, re-experiencing, avoidance, the starter responses or hypervigilance symptoms, and now they added to DSM-5, of course, the dissociative symptoms. And sometimes you have other means of symptoms that needs a little bit of more understanding, like poor school performance. And that's a big issue. And sometimes you have a totally different presentation, like bedwetting, for example, or like pains in the ankles, in the knees, or in the abdomen. Children, we have seen children, unfortunately, who were extremely affected, that they were presented with poor appetite, with weight loss, and some children were presented with severe dissociative symptoms, So it's quite a mixture, but that's why you need to educate the population. You need to tell people that bedwetting, for example, which is the most common, by the way, symptom that we see, could be just a sign or a symptom that the child is dealing with a trauma that you need to help him or her deal with it. While people will understand that a night terror or a nightmare is clear symptom of trauma. That's why you need all the time to educate the population, to talk to them.
Makes sense. Yeah, I think people do oftentimes miss out. Like nightmares, night terrors, like you said, are very common because it makes more sense. Like if you have had a bad experience, that you're re-experiencing that in your dreams. but bedwetting or even some of the somatic, like you mentioned, joint pain, stomach
Yeah.
problems, these are also symptoms of trauma. Trauma informed care has become like a very common theme in the West now. I think there's a lot more push towards trauma informed care. And here we also noticed. I was doing supervision earlier with one of my supervisees, and they were talking about ADHD and the issues of attention deficit and hyperactivity. Oftentimes are as a result of trauma as well,
Yeah.
right? Even in adults, because as when they were growing up, they experienced stress, and we know from research that children as young as 6 months can take in the stress of the mother.
Yeah.
And so people misdiagnose that as ADHD, and then when they're medicated with ADHD, and it doesn't work after a while, and they engage in substance use and addictions like video game addictions and things like that. So I think it's important, and you're obviously in a place where there is trauma, and that's something that you can see.
Well, there are long-term, if I could say, manifestations of the trauma. One of them, as I said, poor concentration, but that
Mm-hmm.
could appear immediately once the child goes back to schooling or once the academic system is resumed. However, there are like more subtle things, like for example, violence among children. Because they become, in a sense,
Mm-hmm.
hyperactive, but in the other sense, disobedient.
Yes. Yes.
Any hyperactive child, a child who's jumping from here to there in his uh, place of living, in his home, at home or at school, he will be all the time asked to calm down.
Mm-hmm.
And sometimes parents do it in a smooth way, sometimes they do it in a different manner.
Mm-hmm.
And that happens in schools also. And that would end up having the child in a vicious cycle, when he is punished one way or the other for being
Mm-hmm.
hyperactive, while at the same time he has his own internal suffering that he does not know how to deal with it,
Yes.
because it's not conscious, that hyperactivity. And that's something that we need to tell people about. But this is not enough. You need to involve the parents, and you need to involve the structures that are around the children. It's not only the family, but also the school system needs to be involved with that. We have a very nice program that's called Sport for Smiles.
Mm.
People can go to our website and look at some of the videos that are published. So this is a very creative program or project. What we do is that we identify about 5 sport clubs in the most marginalized areas. But they should be nice place. I mean, equipped to receive children.
Mm-hmm.
And then we ask each of the 5 sport clubs to nominate 4 sport coaches.
Mm-hmm.
Usually half of them are men, half of them are women. So we give them a very simple training on general issues, like child development, like how children understand trauma. And then we tell them a little bit about how the trauma represents itself, how the complaint could be dealt with at a very simple level, how you can deal, for example, or intervene with a child who is having problem of concentration, who is isolated in some corners, in the class or in the
Mm-hmm.
club, and how they can offer containment to those emotions, and then how to provide the children with some communication skills, with abilities to deal with their anger, handle their, if I could say, aggression, etc., etc. And then we try to identify the children who would join those activities through the local community or through just visiting schools. We tell them you can nominate normal children or can nominate children who appear to have some problems. So school counselors help with identifying them. Now, what happens is that those children come like twice per week for like an hour and a half session.
Mm.
They are the main purpose. The same purpose is that they are receiving some training on football, for example,
Mm.
volleyball, basketball, or some basic exercises. But through that exercises, they also learn how to work together, how to play
Mm.
together, how to get rid and deal with their angers. How to soften
Mm.
the, for example, if we could say, temperament that
Mm.
they have.
Mm.
And when there is a problem, or some child has a more serious problem, then there is a counselor, our psychologist, who is available in the
Nice.
in the place. So, for example, last year we took five sport clubs, 20 sport coaches. We have seen more than 400 children.
Wow.
So each like 200 were boys, 200 were girls. And when you look at the video clip, they say we have learned to play, but they have also learned to communicate with each other and to overcome difficulties. Now, the interesting thing, what brought this up is that this is running, I think, now for 5 years or 6 years. And as I said a little bit earlier, that we try all the time to, some parts of research is to just assess whether we are in the right direction or not. And we did an assessment of that project in the first year, and then we had some qualitative and some quantitative results, but I'll take more about the qualitative results. It was interesting to find out that children who attended those activities improved at their schools. You know, their school performance got better and better. The funny thing that was parents were too much hesitant about sending their children to sport clubs because sport is a waste of time. Sometimes parents think, and children, they play a lot, so they play, and then you send them to a sport club. It doesn't make sense, isn't it? Yeah. But at the end of the first semester, when the children were performing better, it became a request of all parents. Okay, when my child is going to go to that sport club. So community engagement, engaging the facilities, engaging the environment that the child live within is very important. We see that children maybe one session per week. We offer play therapy, we offer art therapy, whatever you could imagine that works, we offer. But at the end of the day, you are spending 1 hour or 2 hours per week with a child, but his mom and dad are spending the whole week with him. His teachers will stay every day with him for at least 5 hours, and that's where we need to invest.
I appreciate that. My internship was in a facility here in Chicago, where children who were removed from their homes because of abuse, coming from rough. There's some really rough neighborhoods in Chicagoland area, that they were in this residential facility. And when you mentioned a comment earlier, it kind of clicked for me because I remember one of my struggles I had in the beginning there was that we would be doing something and everything was calm, and all of a sudden the child would create something. These kids would start fights, arguments, and we're watching a movie or we're having a party or something, and now we're fighting and it's becoming a mess, and they would get in trouble and punished. And I never at that time I never understood what was happening until my supervisor worked with me. And later, when I learned more about trauma, it made a lot of sense. There was a quote that I remember. It stuck with me for a long time. It said that for people who are traumatized, the certainty of misery is preferred over the misery of uncertainty. So because the traumatized individual has this uncertainty, anxiety there all the time, so they create the chaos, they create the misery in order to have some control. Right? So I think you're right. It's important to understand and also give them an avenue for them to take that energy out, and that anxiety, because anxiety naturally causes you restlessness. So having sports or having some of these activities, and while doing that, you're learning how to work with other people, and team building, and I think it's crucial. How else do you treat it at the therapy level, like in terms of, I think this is probably a debate, like, but in the West, the gold standard therapy for treating trauma is exposure therapy, right? And they say exposure or debriefing therapy can be helpful. Now in the West, they're also utilizing like other medications, like psychedelics. I think in Israel they had some study on MDMA and others ways to how to treat trauma. So what other ways do you incorporate into your practice?
Well, it's ironic when you said exposure therapy, because the whole living conditions in Gaza are exposed. Exposure, is exposure. Okay. What we try to do is we do things in a different manner when it comes to children. For example, what we do is more into play therapy, more into art therapy, and then sometimes psychodrama. We think that play therapy is more important than anything else. Bring the children together and encouraging them to talk about how they feel, how they see things. In psychodrama sessions, for example, this is important. But involving the parents again is a very important part of it. And I can give you an example of how we do play therapy. In each community center of the three, and even when we work with schools, with kindergartens, with sport clubs, we equip each place with toys. Now, the toys we have at the Gaza Community Health Program facilities, we have diversity of toys, whatever comes to your mind. So, for example, you can have family structures, or like whole house, structure that you can see the windows, you can see the doors, you can see the kitchen, you can see everything. Or you can see animal toys, or you can see, for example, cars, police cars. You can see planes. You can see also tanks. You can see jet fighters. You can see all the kinds of toys that you can imagine. And you let the child, and you see a football, you see a place where you can play basketball, etc. You let the child inside, and after an icebreaker, you ask the child, what kind of okay, go and pick a toy that you would like to play with. Now that's very important to observe what would the child pick,
like which toy is he choosing.
Yes,
over.
exactly. So
Yes.
one child, for example, might pick the family structure and start to play with it. Now children, when they do that, they mimic what happens to them, what they see in life. So they can pick the family structures and say, here is daddy is coming from work, well, daddy carries some nice food with him, we are eating, we are happy. It could be say something different. Well, dad is coming, he is shouting, screaming, my mom is crying. So that would tell you that the child is really concerned, or his main issue is within the family.
Yes.
But sometimes another child will come and will go immediately get the tanks, the jet fighters, the soldiers, and start playing with those toys and telling the story of something that he saw, or he heard about, or he's afraid of. So that will take you to a different reality, different kind of problem that the child might have. And then some children will think that they are a little bit older, or they are really older, so they can use the paper and pencil, or crayons. They can draw whatever comes to their mind. So in a sense, these kind of activities are not at the beginning. They are diagnostic. They help identify what's the problem, and then they become part of the therapy, because you help the child reprocess the things, talk about things and overcome the difficulties they are facing. Now, within the same time that things are happening, you either have one of the parents, for example, or both in the room, or we like more to have them behind a one-way mirror, so they can see what the child is doing, and they can also hear what's happening inside, what the child talk about. Now, the other important thing, which was really ironic, is that our psychologists really do a lot of nice work. So when they play with the children, they sit on the ground floor, on the floor. They bring the toys, they play together. The children bring the toys and they sit and they play together and they talk together, and the parents see that happening. And this is interesting because in many ways, when you tell the parents to allow children to play, or get some engagement with the children, or play with the children, you will see, for example, they bring the children, they bring the toys, they sit in the same place. Maybe the father is watching the TV while the child is playing, or maybe the mother is also watching the TV or in the mobile phone, or simply cooking, for example, and that's how we play with the children. While in reality, it's not that way. You need to sit with the child, you need to exchange, you need to talk, you need to play together to get more into it. Okay, and that makes a big difference to the children, and that makes parents understand that this half an hour perhaps per day is quite important to the child. It helps a lot calm the child before he or she goes to sleep. Telling a nice story before sleep, that could help a lot in avoiding having a night terror or a night mare. So the environment also is, as I said, it's still very it exposes people it keeps reminding people of what really happened. For example, we say that the drones are still, they keep flying in the skies, 24/7 in Gaza Strip, and they keep reminding people of what really happened. The houses that were destroyed, that were not rebuilt, I mean, the place is still there, but the house is not there. Maybe the destruction site is still there. So these things remind people, remind children of the things that happen. We say that those things delay therapy, make it more difficult, complicate things, but that's how things.
Some water if you want to.
Thank you.
Yes. Thank you so much. No, I'm good, sir.
Yeah. So this is what I would say about trying to help children and about trauma exposure therapy. Now, for adults, it's a different story,
Yeah.
or for children who are adolescents, like 13, 14, who are really expressive. Younger children are not expressive. They don't know how to express their feelings. They don't know how to talk about it.
Words.
So that's why we use the play into that. Bring the play. But for older children, it's a different story. We apply more like closer to a cognitive behavioral therapy. Narrative exposure therapy and those kind of therapies. I think they would come later. Yeah.
So we were talking about treating now with adults. You mentioned two symptoms that I picked up on, at least as a psychologist. I pick up on symptoms. It's easier to recognize them. But one of them was on the symptom of screaming and conflict between husband and wife and parents that children are obviously indirectly exposed to. And the other thing you mentioned was also like watching TV or being on technology, as a way to like escape because the reality is too painful. So if you tell us a little bit about, like, how adults are manifesting some of these symptoms, and then I think you also were trying to allude to like how do you work with adults, and because it's a different area, and obviously they need help as well because they're the ones who are taking care of the children at the end of the day. So
when adults who present to the community center that have diagnosis, it's mainly, as I said, depression or anxiety disorders. Okay. And this we deal with depending on the diagnosis and the relevant psychotherapy. Many patients are on psychotherapy alone, but many others are also on psychotherapy plus medication. And that's because the conditions are, we keep saying all the time that it's never a PTSD. Why it's never a PTSD? Not because we are not exposed to trauma, but you haven't reached the level of safety or security after the traumatic event that will entitle you to be in a post-traumatic
makes sense.
Environment. It's more of ongoing traumatic conditions, re-traumatizing conditions. And this is quite challenging. How can you help people overcome the difficulties they faced when they are not living today in a safe environment? It's quite difficult. So that's why you add talk therapy and medication. And with time, unfortunately, more people are in need for both. So in need for medication in addition to talk therapy. Now, again, there are some other manifestations that are not clearly linked, to the trauma, but we see that, for example, increase in domestic violence, increase on aggression. That could be the father, that could be the mother, that could be both, that could be the children, So, and we have some statistics that they say that the figures are not really low when it comes to domestic violence, for example, when it comes to violence against women, for example, or gender-based violence. And that goes high whenever there is something wrong in the community. Of course, during COVID, we have seen that it increased in Gaza Strip, like many other places in the world. But also the deteriorating economic conditions also had a heavy toll on the population. You speak about a population with more than half of the people unemployed, half of the people live under poverty rate. It's an overcrowded population with more than 13,000 people per square miles. The area of Gaza Strip is a small one, and the population is 2.3 million now at the moment. So Gaza Strip is about 20 miles in length, 20 to 24 miles in length, and about 8 to 12 miles in width. And within that small geographical area, 2.3 million live, and half of them under poverty rate. So you can imagine how things are. And you add to that the blockade, you add to that the difficulties in moving around, you add to that the problems with power supply,
Mm,
um, and it sums up, and sometimes if you are a father and a mother and you feel that you cannot really fulfill the role that you need to play, for example, providing financial support to your kids, for example, offering some good meals to the children, or in times of attacks, of offensives, not even being able to offer any kind of safety or security to your family. We don't have shelters when it comes when there are
mm,
some attacks. People just go to schools. That's where people go. So thinking that it might be safe.
mm,
So in total, there might be those kinds of manifestations that people start to exhibit, start to show,
mhm,
and sometimes why, for example, they say, "Well, he is getting a lot nervous since he uh, left his job, or
mm,
since he stopped working, or since he lost his job."
mhm,
And usually the wife feels it,
mhm,
that this is the reason. But again, I think this is not, it shouldn't by any means an excuse to be more aggressive or violent towards the
okay.
children or the wife. But that's how things sometimes happen. And then it comes, the question is how to deal with that, and some of the uh, mothers tend to bring their children complaining that the child has a problem. And then when you are in the play therapy room, you see the family structure and you
Mhm,
understand that the problem is with the family.
right.
And sometimes the mother brings it up by herself,
Mhm,
so children could be a tool of seeking help, and then you work with the child, you work with the mother, and then you start also involving the father.
nice.
So those fathers, in many cases, they are other victims, but who are showing it in a very wrong manner,
Mhm,
and then you have to deal with, to help the whole family, you have to make parents understand what could be the impact of such a behavior, and to give them some tools to deal with their anger, to manage their anger, to be
mm,
able to not to abuse their children, do things in a different manner,
mhm,
so sometimes it's building communication skills, sometimes it's anger management, sometimes
mm,
it's stress management
mhm,
that could do a lot of magic. And sometimes it's just a simple talk and simple understanding, and then the father will understand how terrible that behavior is,
mhm,
and they will tend to do many things. Of course, we cannot offer people money, we cannot give them
mhm,
money, we cannot give them
right.
economic support, but you can tell adults, to talk more, you can tell them to go out more, you can tell them to go to sports, you can tell
Mm,
them to have some exercises,
mhm,
some more spiritual activities, for example. You can tell them different things, in order to make them uh, uh, ventilate and get
mhm.
rid of those stresses that they face. But again, things unfortunately are deteriorating in the last 15 years, and we hope that inshallah soon
Inshallah.
the blockade will end, things will get improved,
Inshallah.
and we are waiting with patience.
Inshallah. Inshallah. Allah give you sabr. I know it can't be easy. But I come from a Kashmiri background, but I know the situation in Gaza is far worse than what's even happening in Kashmir. But I can imagine like there's a lot of work that needs to happen, and inshallah that after hardship comes ease.
Inshallah.
I wanted to ask you, so Khalil Center specializes in Islamically integrated psychotherapy, and the model that we've developed and that work on and we train in, and our approach in the community is to integrate Islam and psychology in a manner that is beneficial for the individuals, and allows them to be themselves, and not feel that the treatment they're receiving or the intervention, even the preventive work, is like the other, right? When it comes with the integration of Islam, they're more receptive to it. Is there any room? And I mean, the work you're doing is more emergency room work, so I can't imagine this. You have to sometimes just put out a lot of fires. But do you incorporate spirituality or Islam into the practice, and how have you found it? Because I'm personally intrigued, and I want to know more about how you find it to be helpful.
Well, in our area, it's most of the people are, how to say, if you could say, religious. They try to follow religion. They do their best to do that. But our practice really, and the clinic is just at the level of stress management, at the level of cognitive behavioral therapy, at the level of other types of psychotherapy, or at the level of medication. Um, uh, Spiritual issues come, of course, during therapy, and we try to tell people the importance of patience, that things will improve, because all the time it's already proven that higher level of education, for example, more spirituality, more engagement in religion is a protective factor for all population across the world. So, but it's not. I wouldn't really say that spiritual therapy is part of the work that we are doing. We can look together into that, in the future.
Inshallah. Yeah. I mean, even for us, like I mentioned before, sometimes people come in and they've gone through a severe trauma. And this is the big question that people usually put up is, my sheikh says if you're depressed, you should pray more. So is that the right approach? And I said, I mean, that's not the right approach from that perspective, but certainly religion can be protective. It can create resilience, in people. But you could be the most religious person and still have, psychological responses, and that's completely normal and human, right? If somebody goes through a trauma, there's nothing wrong with that. So in the beginning, when they have complex trauma, it depends on their level of religiosity, but if they do respond to it, then we try to bring that in. There's, I think, one person asked, I want to make sure I get to these questions here too. How can you differentiate between a child who actually has ADHD and a child who had trauma but exhibiting ADHD symptoms? So in your experiences, how do you what's the best way to distinguish that?
This is a this is not an easy task. It's a very difficult one, but it's very important to carefully look into the history. It's crucial to understand when those symptoms appeared, whether we can link it to a traumatic event or to a certain moment in time, and then try to figure out what went wrong. Sometimes the child was never exposed to any traumatic event, but then those symptoms appear. It's different from someone who was normal, behaving well, with no hyperactivity symptoms, with good concentration, but suddenly something happens. Then you try to start. You start to think that's one aspect of it. The other aspect of it is to work with parents. You know, uh, even when we are treating trauma, you try to help children in behavioral techniques to try to calm them down, to try to work with the problems of concentration, problems of hyperactivity. I wouldn't say that this helps both disorders, but the response is somehow can show that it's more of this kind and more of that kind. And then one final thing is that you don't need really to know the diagnosis from the first session.
Right.
I mean,
Yes.
Take your time.
Yes, agreed.
Do not rush into that, and try to involve the parents and make them think a lot about what could be the problem, what might went wrong.
Agreed. Yeah, I think this question comes from a clinician, and I've in my supervision work, one of the things that I try to emphasize is, just having a presence of someone there listening to you, and you having that space to be able to express yourself is very therapeutic. So oftentimes you don't have to worry about what's the diagnosis, how do I treat it, should I give homework or not, and what's the next step and treatment plan. Those are there for to keep you, make sure that you're not falling off a track, but just being present and listening to the person, helping them express their emotions. Sometimes if they're blocking it, having them to evoke those emotions, that can be very helpful in that safe area, in a safe place. And you don't have to worry too much about how do we just do diagnose properly. Someone else asked, can you talk more about your experiences with art therapy in Gaza? And I want to add to that, like you mentioned earlier, as clinical psychologists, we do projective art work, like where you ask children, like you said, if they draw something or to pick a specific toy, they're projecting something that's in their subconscious. So if you can add a little bit about that too, but how do you do specific artwork?
Well, mostly it's not projective play. It's just free. You can pick whatever you want. You can draw whatever you want, and then the talks follow. That's most of the time. But projective toy use is more of the psychodrama practice. You have children in the same room, 10 to 12 children, and then you bring toys, usually of animal structures, and you try to engage the animals together. Okay,
Mm.
so the children start engaging their animals, their toys together, and then you can see what happens. So this is something that we do. Um, yeah.
Okay. I want to shift just a little bit to like the immigrant adult population, because there's a lot of people, especially in the Chicagoland area and other areas in the U.S., that have come from Palestine, have come from those those traumas, because it's been there for decades now, and there's intergenerational trauma as well, right? And now that they're here, they begin to experience some of these behaviors, whether it's substance use or domestic violence. How do you or first off, like, how would you help recognize some of those behaviors as being response to trauma, and then what advice would you have for those people? Because I think here, when we work with, like, say, children of families who come from these traumatic areas, it's the same idea as, like, oh, he's the problem, the kid is the problem. When you look at the family, you recognize the family unit as a problem. When you start digging more, you realize it's more of intergenerational. There's more like trauma history. So I think, how do we begin to kind of have conversations about that?
Look, I think one important factor that we always have to keep in mind is that when you live in a place like Gaza Strip, you are exposed to trauma, but also you keep to live under stressful responsibilities.
Mm,
For example, you need to make money. You need to look for the care of your children. For example, for mothers, if they are not working, then they have to make sure that the children are fed well.
mm,
So part of your mind, and it's not a small part, is engaged with the daily realities and functions.
mm,
You are not even given the time to digest the trauma. You are not even given the time to talk it out,
mm,
to get rid of it.
mm,
Now, when you suddenly find yourself in a different place, in a different atmosphere, with all these stresses not there, and the migration process begins, I mean, the requirement when you land and when you become accepted, if I could
mm,
say, then in the beginning you are given some kind of support that will help you just start your life.
mm,
Now, this is a very critical moment because the responsibilities that are on your shoulder are way lesser than when you were in
mm,
Palestine, for example. And then things will start to come up to the surface.
mm,
So the unconscious will start, just bringing it up in a way or the other.
mm,
Memories. When you try when you start to compare how life is in Gaza, how life in here, for example, how difficult things were, how difficult are here. Now these parallels, drawing those parallels, and the sudden feeling that there is no obligations, there are no responsibilities. This is a very important moment that you need to really take care of the immigrant
mm,
population. And I think it's very important, and it's part of the therapy, is to find something that would engage them into their future
mm,
life. It's not enough to tell them, okay, go to find job, to go to identify a place of work, and simply leave them in a place when their food is prepared, for example, and they have enough cash just
mm.
uh, to live.
Right.
That's not enough. That could cause a lot of harm.
Okay.
The better way is just to give them to give them something like a task that they have in hand,
Mhm.
and that they can start working immediately on their future.
Yeah, in the immigrant population here in the U.S., at least in the ones that we work with, Muslim populations, we see this issue of, like, they're in a much better, safer place, but then there's, like you mentioned, subconscious and some underlying psychological processes that tend to affect their day-to-day functioning, behaviors. Like, one of the common thing is, like, immigrants are always in survival mode. They're trying to survive, so the pushing the children to, okay, you have to become doctor, engineer, businessman, lawyer, whatever, because if you don't, somehow, like, life is not going to be good enough for us here. And obviously, because of Islamophobia here in the U.S. and after, especially our last election, things got pretty bad for Muslims here. So there was, I think, we're hitting about the 6 year, anniversary of the Muslim ban that happened here, and so I think then those things are also here. People, most individuals are not even aware. I think it's important to then increase, like you said, to think back and recognize if there's some negative patterns emerging, what could be the reason for it, what's causing this, and then to get the proper help. Now, alhamdulillah, I think here in the Chicagoland area, they've been doing a lot of community work, so people are becoming more aware, and they're recognizing, and we're seeing even adults coming to therapy. Before, it was very rare. Child has a problem, school, and the school refers the child here. They come here. They're kind of forced in many ways, but adults wouldn't engage. But now we have like adults who are also recognizing some of these things. So inshallah, I think that will happen. I want to end off by asking you, if there's something that the people who are, I mean, even for myself here, first of all, but what is it that we can do other than obviously, making dua for the people there, sending financial support for the people in Gaza and for your organization because you're doing such beautiful work. It is any way for people to support, please let us know.
Oh, well, this is a tool that is in one part to look for more engagement,
Mm.
and that includes to get more engagement within the professional community. There is something that could be done in Palestine to help people. Then that's welcome. Although we are very uh, uh, we have many constraints. So, for example, when someone sometimes people feel bad about it, but that's how things are. When someone says, I would like to volunteer, we ask, please send us your CV.
Mhm.
Where is your area of expertise? Because we do not like to expose people to secondary traumatization, for example, and we don't want to expose our clients to any
Mhm.
harm, because the realities are extremely different.
Yes.
And you cannot, as a therapist, get really engaged with the client unless you know very well the atmosphere. But we help we think that it's good to establish relationship between professionals who work, for example, in technical staff who work in the States or abroad, with technical people in Gaza Strip. They can offer some kind of supervision, some kind of support. There are also sometimes areas of common interest when it comes to research. Obviously we don't have that much time, and we don't have that much really expertise when it comes to research. Research has changed a lot during the last 2 decades, for
Mm.
example, and unfortunately, being under blockade, we are not up to the developments in the research methodology. So that could be another area of interest. And then there are sometimes people who come to visit Gaza. I know it's very difficult to visit Gaza, but it's good to try to come and visit Gaza. Financial support is also important. We are a non-governmental organization. Everything that we do is totally dependent on donations. The Gaza Mental Health Foundation, the Boston-based organization, is the main sponsor of the tour.
Okay.
They are completely volunteers. They do not charge anything, and any donation that comes to them goes directly to Gaza, which is nice. Our organization is a non-partisan. It's quite well known locally and internationally for its high quality services. Its community engagement, and we appreciate any kind of support. And I'm really glad to be today here at Khalil Center, and inshallah we look forward to build on this
Inshallah,
visit.
inshallah. No, I'm glad you mentioned the research part because for people who are going into the field, this is one of the unfortunate side is that you have Muslims who go into the field of mental health and they're doing a dissertation or a thesis. Even that research which they have to do, can be on something that could maybe give some input and benefit to a program like yours, for example.
Yeah.
So and institutes here oftentimes can't even fund people to go do research in Gaza. So it's not unheard of. And I think it's just a matter of us trying to find the right people, right resources, but definitely to reach out to you and even through us if anyone is interested, I think we can facilitate that process. And then what I'll do is I'll share both of those organizations, yours and the Boston organization. I'll share the link to the website,
Yeah.
so people can, inshallah, give support to that as well.
Thank you very much.
Yeah. Any other comments? Anything else that you have?
Thank you.
You'd like to
I
hear?
would say my best wishes for your great job to continue for the sake of helping the community in Chicago and at large in the States. And yeah, we look forward to continue this our kickoff cooperation.
Inshallah. Yeah, in our field, whenever somebody comes in, I always tell them, you're going to find a lot of fulfillment in the work that you do, and your intention has to be very clear that you're doing it for the sake of helping people, because this is, if anything, mental health is that area where people don't come for money. So may Allah reward you for your time and effort, and I know that you're putting a lot of your energy and sacrificing so much, and everybody from your organization, and may Allah accept all of their work, and even from our end, because ultimately it's much needed work, and we're all and there's a lot of fulfillment in this world, and also in the next world. So we appreciate that.